Welcome everybody to another episode of A Lovely Snack with Dr. Lovelee. Today I have a friend, a colleague, a man. I'm saying that because you're the first man
Seriously?
as a guest. Yes.
I'm a man in a woman's world.
Yes, you definitely
Actually
are.
am.
And you'll get to find out why. Thank you so much for watching thus far. Please continue watching, sharing, so that others can also get to see what you see, learn what you learn, and also have fun with us. Because I have a man today, I asked the man what he drinks. I bought this whiskey, in 2023.
Justin J or
Justin J because Karabadilo.
okay.
Ne?
I see
And
that.
it's been waiting for a special occasion. But then I also am not a special occasion kind of person who waits for things to happen. But here we are. Today is that occasion. So you get to do the honors.
Thank you.
The reason why I bought this is because it mentions something about wine. It says, apart from it being a limited edition release, there was a wine something in its description.
Okay.
Yes. Whiskies from the finest French and Italian red wine casks.
Oh.
So they didn't add wine, but then they
it's from a cask that had
red
so
wine.
I don't know much about whiskeys. I love them. I don't know so much to tell you about what they do and whatever. I've got a friend who will tell you about this bottle. No, I've got a friend who will look at this bottle and tell you which area, which region, how they make it and stuff like that.
Okay.
He's
got
really a big passion for it.
Limited release. What.
Well, thank you.
Like me when it comes to wine, I know what I like.
I know what I like,
yes.
And I'll drink it.
Yeah. As long as
there's tones and aftertones and other things. I know nothing of that. I just enjoy the taste, and that's me.
There we go. So as you prepare our drink, by the way, I'm not gonna have it like the way people have whiskey, but
No, I have it neat as it is. Yeah, all the time.
I'm gonna have mine as a hot toddy.
Okay.
So I'm gonna make mine in a cup, like a tea. I'm gonna ask my little helper on the floor to hand me the hot water. Thank you. Can I have the shot glass? I want to measure mine.
Okay.
It's just behind the.
I measure with the eye.
Yes. You measure your alcohol like I measure my food when I cook. Yeah.
That's the only place I measure stuff with the eye.
Okay. Yeah, because in our job, the things which you measure, yes. Speaking of jobs,
precision.
What do you do?
A doctor like you. I am a gynae. I practice in Tshwane and Tembisa.
Is Tembisa private or?
So they're both private practices. Okay. So the one in Tembisa at the Landmed Zamokuhle. In Tshwane, I'm at the Raslouw Private Hospital.
Okay, so that's where people find you in Zamokuhle.
Yes.
In Tembisa, and then in
Raslouw. Well, the practice is in Raslouw Wellness Center, and then I admit at Raslouw Hospital, and they just next to each other. Yeah.
Cool. So I'm gonna stick it to your jaw.
Okay.
For a little bit.
Sure.
Because I feel like your field. First of all, let's start here. How many there's stereotype or stereotypically? No, stereotypically, gynecologists give why?
It's actually not. There's actually I have a sense that there's a lot more female gynaes now. Yes.
But previously.
But that's everywhere in medicine. If you think back to your class in medicine, you might have found that in your time, there were fewer women in class as compared to men. And if you go back 20 more years,
Uh-huh.
even fewer. So over time, women only started like getting into the space of medicine. It's not that gynae is loved by men.
Okay.
It's just that we just only just starting to have some form of equity between male and female in terms of doctors overall. And then when we get into specialization, well, like I said, right now you find that the numbers balance somewhat. But I think the reason why right now, because you get like old gynaes and like really, really old gynaes, and they usually make it. So, yeah.
And I mean, to be fair, there had to be doctors for women.
Yeah.
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 They weren't all gonna become other specialties.
Something needed, yeah. Somebody needed to do the job.
Well, they have those innuendos about it.
Look, it's such an annoying part of the whole of it almost feels like a disrespect to my profession. Absolutely, to be honest, right? Because I think gens tend to get excited by the idea of something that doesn't excite me, or I'm not excited by what excites them. Because for males in general, when you're speaking now about female genitalia and whatnot, it's something that's intriguing sexually, right?
Meanwhile,
for me, it's not female genitalia, it's the female reproductive system. It starts from the glands in the brain to ovaries to uterus, cervix, and literally the perineum forms a very small part of it. Yeah. So, but guys tend to be like, so you're a guy. Then the topic changes completely. First of all, in social settings, I generally don't like if people don't know that I'm a doctor. I'm happy. I don't say it.
Thank you, because I'm the person.
Yeah, but somebody will inevitably mention it. And then it's like, oh, so you're a doctor. What kind of a doctor are you? And I'm like, oh, here it starts. Then from that point, I don't even say it. Somebody's going to say it or they're going to laugh. And I already know the topic is going to go. And it's going to be those typical questions. So how does it feel? Do you look at your wife the same way? And stuff like that. And I'm like, yeah, it's I'm always like, can this part just pass so that we can move on to the next part of it? Yeah. But then somebody will again after 30 minutes ask me about my job, and I'm like, why don't we ever talk about other people's jobs? Like, guys, come on. Yeah, it is annoying, but the concept of males going into this profession because of them being pervert or whatever is actually completely untrue.
Absolutely.
Completely untrue.
Okay. So what is your gynecology and obstetrics? You are an obstetrician gynecologist, not just a gynae.
The beauty of life.
Aww.
That's the shortest. That's the shortest.
No, but it is what it is.
It's just intriguing. I actually didn't want to become an ObGyn.
This is nice.
Okay.
I think I must make you one because I'll tell them why I'm making you one. But you didn't want to become one?
I didn't want to become an ObGyn when I was in med school. So I remember sometime in second year, there's a video of a pap smear being done, a video. And I was just
like, because second year we're not really doing clinical hardcore.
So we had not been introduced to any of these things. So I was just like,
So as per tradition, I don't know if you've seen my podcasts, and if you haven't, don't tell me. We have a snack, and you have to eat, because I made this food for you. So I like things, and I am the most cliche person I know. I'm gonna pick this up and I'll put it on my plate and eat it later. This ravioli over here is heart-shaped because it's also lovely. Right? And Tshiamo has braces. Matata go se trust fund. We did not grow up.
This would have been done.
We did not grow up in a trust fund.
This would have been like long.
Having to now fix yourself as an adult with your own money. So I had to think very hard and carefully about what I feed the man today. It had to be things that are soft and not gonna get stuck in his braces. And then hence this thing, and when he gets home, he must sleep 2 for 3 hours. So there's a lot of pasta here. There's the ravioli, and then there is a warm pasta salad. Okay, I hope you eat cheese. I forgot to ask. I just asked you about your voice, but I didn't ask about allergies.
I'm on a seafood diet. I seafood and I eat it.
There we go, fabulous. Then there's some yogurt and soft mango and something to nibble on. So when you feel like you're guided to nibble, go ahead and nibble on up a tree.
Looks nice.
Thank you. I try, Gazanoids. I'm a domesticated doctor, Gazanoids. Okay. So what sparked your love for gynecology was seeing a video in second year?
No, actually no.
Okay. Oh, okay. Okay.
I did not want to become a gynae at all. And I knew this in second year.
Because of that video?
Yes. So we were being introduced to clinical medicine. So in one of our practical classes, there was a video that they showed us that on that video they were doing a pap smear.
Okay.
And I
was like,
it's just like,
I am not doing
that. And they were showing us the cervix, ne? Like,
yes,
the video was showing us only the cervix, nothing else. But I was just like,
not for me.
This is definitely not for me.
Not ever.
A few months down the line, a video again of a woman giving birth. That's part of our training. Obviously.
Yes.
And I was just like, no, I cannot. So when we got to, I think the following year, university, we started like our clinical years in third year. So when we got to the actual now clinical rotations, I remember when I was supposed to do a short, like 2-week rotation in obstetrics, and I was just like, I can't wait to get to the other side of the 2 weeks. But that, I will say, was probably the best 2 weeks of my experience in that year, or at least in that semester. Reason being, just that whole being there, watching a woman giving birth and everything like that, basically seeing life happen,
come into being.
I just spoke to my soul. If we do have souls, but yeah, it spoke to my soul.
We'll get to that. Yes.
So it spoke to my soul, and I didn't even realize it at the time. I only realized after, in retrospect, that I actually enjoyed that rotation. So when we did more of obstetrics, I enjoyed it more and more and more.
Okay.
The one specialty that I thought I wanted to do was the one that I didn't enjoy.
Which was what?
Take a guess, honestly.
Urology?
No. I enjoyed urology. Actually, pediatrics.
So funny.
It's like, I love kids. I absolutely adore kids. I realized very early in my career that I do not like seeing kids sick. And it does something to me that I just can't deal with. So I was just like, I can't. And even kiddie cancers, like cancers in children, it's just something I just couldn't. I don't know if I'd say I'm too empathetic for that or whatever. I just can't, and I couldn't. And I was like, look, I love it, but I don't love it. Yeah.
I'm going to add to that because that's actually my actual experience. I wanted to do pediatrics when I was in mid school. I was, in love with the kids. Even did during my 6th year ped rotation, I adopted a child. I did adopt a child in the ward, but I actually wanted to take him home.
I hear you. It happens.
And the only reason why I didn't take him home is because my parents were like, or adoption,
it happens. I think I've had moments where I was moved that way also.
Yeah.
I know someone, I've got a friend who actually
adopted. I think we know this friend.
Yes. She adopted.
Yes. Yeah.
So it's been fun to watch.
It's been very fun to watch. It's wholesome to watch. Nice. Exactly.
That's one of those.
And then I went to do community service in a very remote hospital. With no resources.
That's why it does sting.
And where now I finished med school in 2002. So this is like during my training and internship, we're at the height of HIV.
Yeah.
There's no medication for these kids.
Yes.
They're all coming in with bronchopneumonias, and it's 50-50. Already, But by the end of this call, I would have lost half the patients who come in, right? So that just started tugging at my heart on some, do you really want to do this where you can't help kids? You're going to be doing a pediatric rotation for 4 years as a registrar where you just like you're helpless. And then I moved to a rural hospital, and then I decided I'm not going to do this because sick children who cannot be helped is not for me. I used to cry like, I don't know, every other. Yo, no, it was a lot. So I completely get you. And like you just can't.
I just couldn't. See me with kids. I love kids.
But not to see them sick.
But I don't
want to see them sick.
Not like seeing them sick.
Yeah, no. I get you.
They don't like me as much as I like them.
Oh, my.
It's different from child to child. They have different experiences.
Yeah.
So even today, there was one of my friends. So his helper comes in and cleans at my home like twice a week.
Yeah.
And he's got a little one, and so she comes with her sometimes there. If she finds me and it's just me at the house, she's happy to see me. She hugs me and whatever. But if there's anybody else there,
so other people have the problem.
So my wife was there this morning, and she was just with her. It was like I didn't exist.
Okay.
Like, hi, I give her a sweetie. And
no.
Like,
don't bribe me. Stranger danger.
Now I'm the enemy. I get it, but
so when there's other people, they're the problem.
For this one, I'm the least favorite.
But clearly they are the problem because only two.
We are
besties.
Yeah.
Okay. Yeah. I want to wrap up your work stuff with I don't want to call it a new phenomenon. I think as we evolve as a human race, as people, and also not just physically, physiologically, in other ways, where we were mentioning earlier on, there were no opportunities, or medical students were traditionally male, etc. So now there's more female. So even in other industries or whatever, I suppose, let's say career-wise, women are putting that first and doing motherhood later, even though they know that we have the biological clock and things like that. And the one thing I love about the human body is that there's 46-year-olds who fall pregnant like this.
Yes. And
zero genetic issues, and there's 26-year-olds who are struggling. So in your job, you see all these spectra. What is the give me your insights on your experience around that, but also what is your advice? I know there's no always and never in medicine. There's no cut and paste, copy and paste for anybody. But is there a way of striking the balance to somebody who is like, I want to wait, but I'm a bit scared, I'm a bit apprehensive. How do you play by ear? What are the things to look out for to say, do I freeze my eggs just in case? Or if I do certain things, there's no 100% guarantee. I know if I don't drink alcohol, if I don't do this excessively, if I exercise, if I sleep well, if I manage my stress, and I've never been diagnosed with gynecological issues like PCOS and things. Like I'm otherwise healthy and I get checked. Where do I say I can wait till I'm 35, 40 because I want to do my MBA, PhD, wada, and I'ma just play safe? When should they come in? Not to panic, just to check.
Start thinking about thinking about what do I need.
What to plan? Not to panic, but to plan.
Yeah. Preferably before 35.
Okay.
Preferably before 35, especially if freezing your eggs is one of your options or something that you are considering. In fact, the best time to freeze eggs is probably in your 20s.
I was about to say, when it's easy to harvest.
Probably in your 20s, that's probably the best time to like freeze your eggs. But now, you've got this career-driven woman who's trying to make it. In her 20s, chances are she won't be able to afford the whole process of freezing the eggs and stuff like that. And by the time they get to that financial comfort to actually go to a fertility specialist and say, look, it might be either a bit late or like really
not as optimal.
So it's a bit difficult to give advice on that front. Biologically speaking, the best time to have children probably like early 20s. but financially and
mental health.
socially, a whole lot of things. There's a whole lot of things that go
And they're
into
still
this.
teenagers, right? Like literally before 25,
Look,
science says that your frontal lobe undeveloped. You're a teenager.
this is actually gonna sound wrong from a social perspective, but probably like not teenage, but like maybe late teen, early 20s. That's probably like the best time to have children.
Physical health wise,
physically,
but not
physiologically,
but not considering
but
other
not
things.
considering other things. When you're just only looking at the physiology and
capability of carrying, recovery, snatching back, all of that stuff.
Getting back into like full health and stuff like that.
The younger the better. But it's not necessarily conducive for life.
And it doesn't mean that if you're like in your late 20s, early 30s, late 30s, you can't have kids. It's late. It's not. It doesn't mean that I've like you said, I've had 40-something-year-olds giving birth.
Awesome. Oopsie, doctor, I missed my period. I thought it was menopause. Well, your menopause is 4 months old. It's 4 months, 16 weeks along.
Okay, so 40 years is a dangerous decade because people tend to be like, there's no way I'm gonna have kids now. They're like no contraceptions. They're like, then jiggy, hey doctor, I don't know what happened.
We know what happened for you to get pregnant, but as you collab.
And we don't judge, we listen. We
have no reason to judge. It's nature, it's natural.
You made an assumption. It was not the best of assumptions, but nature is quite weird.
Okay, nature is quite weird. Pick it up from there.
Where am I putting this?
Yes. Just put it here.
Okay. So nature is quite weird because I don't know if you've ever noticed that people don't want to fall pregnant usually fall pregnant with ease.
Yes.
People who want
chasing it.
Yeah. And it's such a, for me, it's such a,
it's a mind F.
Yes, I wanted to say
it's the only way to say it. Yes, yeah. Okay.
That's exactly what I wanted to say.
So pre-30.
Because sometimes, sometimes I get one patient who's pregnant and doesn't want to fall. She's not ready for a pregnancy, would like to terminate.
And that happens a lot. Yes.
It's a service I offer. And then 2 patients down, patient is struggling to fall pregnant.
And just like, couldn't you just swap?
We've been, and I'm like, why can't you have,
you can't.
And you can't. That's one of the many drawbacks in medicine, I guess.
Exactly.
One of the things that I found is, people come to us and they expect help,
and there's only so much you can do.
There's only so much you can do, and there's only so much you can try and whatnot, until you're like, I've done what I can.
You've reached the end of the tether.
Is there somebody to refer to? If there is, I do that. If they try and whatnot, until you're like, I've done what I can.
You've reached the end of the tether.
Is there somebody to refer to? If there is, I do that. If there isn't, you just at odds. And
you put all the cards on the table.
But I tell the patient and I'm like, look,
here's where you fit.
This is what I've done. This is what it is. This is what I think is happening with you. Right now, I don't know. It's either we give it time or whatever, but I really don't know. So
I find that I don't know. Patients find it difficult to accept from us. They want us to know everything. Meanwhile, I'm just like, guys,
I don't mind saying I don't know.
Because if you don't know, you don't know.
I really don't mind. And if I ask a patient about, let's say, medications, and she mentions some brand that I don't know, and I'm like, let me check
that one, because that's what I don't know. And you
can't
know everything.
Might be quite, we can't know everything. Despite people thinking that we should or we should. I get it, there's a joke going around now that we use ChatGPT to diagnose patients
and operate on them.
Using ChatGPT,
ChatGPT diagnosis. Oh, shame. You used to be Dr. Google, now Dr. Chat.
Hey, look, you went from Dr. Google to now Dr. ChatGPT.
Yeah. Okay.
So imagine you're asking a patient a question and you're typing it.
You already know, I'm just writing my notes. Don't worry.
That's ridiculous.
Okay, but I think it's good to know that, like I said, there is no always and never.
Yeah.
But I think you say, like, if you've never had issues and you're thinking, nothing's absolute.
So the other thing on that, fertility in women is tricky. It's difficult. You can't just say, I'm going to do a test and I'll tell you if you can have children or not.
Absolutely.
Right? With men, it's easy. You know, they do a semen analysis and that's it. With women,
the sperm is there. It's not.
Yeah.
It doesn't have heads. Doesn't have tail.
Yeah.
It's not swimming. It's lazy.
That's that. And it's all
It's
just one.
Doesn't want.
And it's all just one report, one test, one report, and that's that. With women, you need to know if her hormonal, what's this? I'm gonna use hormonal balance.
Yes, that's the word. It's fine. We understand that.
Hormonal balance is fine. I like saying hormonal regulation.
Yes.
This is what it is.
Yes, yes.
You need to make sure that everything is, the ovaries are fine. The eggs are still there. You need to make sure that the fallopian tubes are intact. You need to make sure that the uterus is receptive for pregnancy. And you can
not
have
hostile.
Yeah.
There's,
there's fibroids, there's polyps and all of those things that can be there. And you can have all of those things right and still not to fall pregnant.
Exactly. Because you could also then not be what's what I'm looking for, where you and the partner actually don't, you genetically you're not making. For some
reason.
Genetically, because I know people who try forever, and then when they're not together, they're pregnant. Within 3 months, within a year, that kind of a thing,
It does happen to some people. I don't think we've got a medical explanation for that, but it does happen. But again, things that we don't know.
The mystery of life.
Yeah, the mystery of life.
Which is why you're in this profession to begin with.
The other one is miscarriages. That's another sore point, to be honest. Especially when
for those who really want
to know why. And there are patients I see that keep coming back with recurrent miscarriages, and then they wonder, why had I started earlier, had this and that. And it's difficult to counsel,
to pinpoint.
Yeah, to say, look, it would have been better if you did or not. We don't know, and we'll never know.
Exactly.
We'll never know.
Because you can do all the tests under the sun and it's not have an answer.
Still not find anything. Unfortunately,
if that is not the purpose of that person to have a child and they're not letting go of that whole thing they're holding on to.
I don't have an opinion on that. I'm not saying
it's a whole other podcast of life and purpose.
No, I'm not saying anything on that. But I will say again, in terms of limitations of doctors, I sometimes say we are not magicians. We don't wave a wand around and then everything gets sorted out.
Baby, here's your baby. You get a baby. You get a baby. You get a baby. Yay!
We get rid of your cancer. We get rid of this illness. We just know what we know, and we can only do best with what we know
and what we have been trained to address it with.
And at some point, like, to be honest, when it comes to the human body, there's so much that we don't know. So much that we don't know.
It's a jungle.
Like even if you get like all the experts together, there's so much. A lot of things will be like theory, but nothing concrete.
This is it. I always joke and say, maybe my knowledge is limited, but I don't know anybody who's got the Nobel Prize of knowledge of the entire human body and how it works. They have systems, like they know how that nail gets, like there's a Nobel Prize in deciding how. No, but the rest from head to toe, from high. That's because there is that allowance and room for how to say it is true.
And people need to also be comfortable with not knowing. Doctors need to be comfortable
with not knowing, and
patients need to understand that we can't know everything. At the very least, say and actually follow up on that. I will look it up, and then
I'll get back to you.
Next time I see you, I will let you know.
If you say, my colleagues and I have gone through, I've presented your case at academic meeting that I attend once a month, and all of us are like, you know what,
and that happens.
Then we feel special because my sister, my brother, it is what it is. You are the special one, And then they ask me, I should donate my body to science. I'm like, go for it.
Unfortunately,
when you are dead, you're not going to find out these problems of what you're doing.
Look, unfortunately, it won't sound nice if it's bad news to say, look, you're one of the special ones. It doesn't even feel special if it's bad news.
If it's something that's frustrating that you want to know.
And it's difficult for many people to accept, you know what, this is me. There are many women who have gone through life and they don't have kids. They've wanted them. They've really wanted them from an early age, from the early 20s. They get into their 30s, they're still not falling pregnant.
And then they're 50 and they're still like Dr. One-on-One.
Just one.
And I'm
It still doesn't happen, and
exactly.
shit happens.
It happens. Moving away from the birth obstetrics to the gynae side, there's a lot of misinformation on the streets. I get ranging from parents wanting to bring their teen kids for, yeah, she's 16 now, or even 18 or 19, and I don't know when to start doing the gynae checks, that she need a pap smear. And I'm like, whoa, we don't do pap smears on 14-year-olds because of a period, right?
Yeah.
And then to the ones who want to do a pap smear every 6 months or every year even, because I must do it annually. Meanwhile, there is no history. There's a history of normal pap smears, and there's no history of exposure or risk. Just touch a little bit on that whole, when do we start and when do we worry? And like, I know, right? But I want them to hear from the specialist. Okay. Because the other thing is, people will say, yeah, I am sexually active at 19. Do I do it? Or do I say about 25 because I know the younger I am, it clears? Like, there's a lot of information on the street there, and like, people just don't know. Some are not coming for pap smears, some are over pap smearing.
Yeah. Yes, that's actually, it's like either an overkill or nothing. Not doing enough at all. And I'm glad you bring this up, because for me, pap smears are one of those things, despite what I said about the video in second year medical school. Pap smears,
when you didn't know what you didn't know.
When I didn't know what I know now. These are very, very important. And it's very important that every woman knows when to do them and to actually regularly do them until such a time when they don't need to.
You can decrease,
right? The traditional guidelines in government were 3 pap smears in a woman's life, in a woman's lifetime, from 30, 40, 50, and that's it. That's an under pap smearing.
That's a bare minimum.
That's like proper under pap smearing or under screening. The rationale in the long-term thing is that from infection to cancer, it takes years, but 10 years is a little bit too long.
It's too long,
right? So just to understand what pap smears are, it's a screening tool to pick up or to detect any abnormalities that can lead to cervical cancer.
Absolutely.
And that includes screening for the HPV, which is a virus that's responsible for this cancer, or also looking at the abnormal cells. So now, depending on which test tool you use, the time frame between tests changes. And then another big factor is your HIV status. So
compromised
people. So just so people know, HIV positive people are at a higher risk of developing cervical cancer. And then for them, if we're going to look at HPV, of which in this age and time is the recommended gold standard screening.
Must include HPV, not just the self, but HPV screening.
HPV must be there. And you could actually just do HPV and not the cells, and then look at the cells if there's HPV, and then interpretation from there. Depends on other several factors. But anyways,
but doing both is more thorough.
Doing both is more ideal, yes. So from the age of 25, every woman needs to start screening. Okay.
If they're sexually active.
If they're sexually active, penetrative sex.
Yes, penetrative
sex from the age of 25.
Where you can get exposure to things up in the cervix because things are going into the cervix.
So HPV, it is not a sexually transmitted virus. Well, it is
not.
It's not considered as STI. Sorry.
Okay.
It's transmitted sexually, but it's not considered an STI. It's a bit of
another MF.
Yeah.
But okay, so it's transmitted sexually. We know, right? It is not in that whole when you screening for STIs. It's not there.
No,
yes,
it's not part of the whole.
That's actually what you mean. Like it's not in the panel. Basically. You have to request for it extra.
Separate.
Yeah.
The other thing is the reason why we separate it from the other STIs is all of them typically have like a very short window period.
Yes.
So you get exposed today,
You
2-3
can
weeks.
You can
there's
see
a problem,
symptoms,
right?
Yeah.
With HPV, you could get exposed today and only start
7
having
years
problems
later,
7 years,
exactly.
right? And I think we do this to also to basically manage the whole thing of now I do an HPV screen and I tell you you've got HPV and you ask me how you got it and I tell you now wajiga ukwatela your partner because you think God has been doing stuff behind your back.
Yeah.
Kanti, you got it from a previous partner,
which is what
also,
I actually tell them.
Yeah, who also might have not even been cheating on you.
Didn't know
just
that
had
they
it
had
before
it.
you had it, or your current partner had it before they met you,
and because it was not
screened. Know.
Yeah.
And screening in men, I don't even know if there's a screening tool for HPV.
I'm gonna tell you because I read an article recently.
Okay, yeah.
We don't screen men who don't have sex with men, who don't have penetrative anal sex.
Okay.
Because it's difficult to pick up the HPV on dry skin. So unless you're doing a urethral swab, which nobody likes,
no man will want to do.
You can do a urine sample. It's not very accurate. They've tried the urine sampling. I have had a few, I want to say 3 that I can remember at the top of my head, positive penile dry skin swabs in my entire private practice of 12 to 13 years.
I have to ask, was there foreskin or not?
There was a foreskin, because then the moisture and stuff like that, but the 2 they didn't have. But I still got a positive swab. And one of the ones actually had a small wart that they were not aware it's there. They didn't see it. When I was swabbing, I was like, what's this? Kind of a thing, you know? So then I obviously then swabbed more around that area. So it's not easy to obtain a swab from a man who's not having penetrative anal sex because the moisture is where a good sample is obtained from. So for men who do have sex with men and they are on the receiving end, you do rectal swabs. Okay? And then for women, obviously, it's from the moist cervix inside. So it's not easy. And my explanation during the consultation is always like, when you get HPV and you've been sexually active with more than one partner, I can tell you when and who gave it to you. So other STIs, there's a timeline you can say, I'm only having intercourse with this person and now I'm sick. Then you can go take it up with your partner. But when the issue is HPV, and a lot of the times the women haven't even done pap smears either ever or their last one was 5 years ago and they've had 2 or 3 partners in between. And one thing I know about a condom is that it's sort of there.
It's not
it's sort of there.
You can't say 100%
because you can say, are you using a barrier protection in the form of condoms? And then the minute they hesitate, I'm like, okay, so when do you decide to play Russian roulette? Because then this is why we're here. When do you decide it's a good day to not have protection? Wow. So now you can't blame anybody. You really, really can't. So the HPV infection, there should never ever be a blame game unless you know. Now I made it Tshiamo. I've never been with anybody else. I've done my pap smears since I've been with him and they were fine. And jiggy 10 years later, I've got HPV. Then it's a very different conversation. But most of the time, it's I don't know when you got it. It takes long to show its head. It can lie here dormant forever. We just screen to make sure you don't end up needing chemo, radiation, and hysterectomy. Yeah.
I will say this. You can probably only like basically with certainty say there must have been foul play if both partners met each other
without exactly, yes.
Yeah, if they both come on and say that like they were virgins and then you pick it up 10 years later, then you can say like,
okay, because it doesn't just enter the house.
Yeah.
It doesn't enter the house.
But
it doesn't walk into your house.
It's also another tricky situation.
Oh my gosh,
it's another tricky situation where you have
and also you can't get it from your mom. It's not you can't get it from
not.
I was born with it.
No, you can't. Not at all. So there's that, and in fact, STIs in general, just counseling when you get like a positive STI screen, it's a new problem. It's I'm always like, I hope.
I think it was last year, early, April. So even there was a Department of Health gazetted or released a memo thingy. Is it the National NIH? The NICD? Communicable diseases. Last year, April, May, guys, there by north of Sentin, north of Joburg.
Yeah.
And I was like, yo, what's happening in Sentin, guys? This is where I live. There was an outbreak of syphilis.
Are you serious?
Yep. And gonorrhea. Syphilis, gonorrhea. So the gonorrhea, chlamydia, and then syphilis. There was an outbreak last year. So people just think STIs are a disease of people who are lower LSM. No, guys, it's happening in the suburbs. Yep. Because I mean that letter came from the private labs. The data. Yes, the private lab data. Yep. We're issuing for listen. We have it. Houston, we are having a problem. We think we have a problem. Yeah.
The other thing, a lot of people have moved towards being less scared of STIs.
Yeah.
But mainly because the one STI that people have feared the most has been HIV for the longest.
And now there's treatment and it's controllable.
And now we're getting PEPs in the form of 6-month injection coming up soon.
Because now PrEP is 2 months now, and then the PrEP will be the thing.
Yeah. This one, it's going to be like PrEP, I think.
Yes, the PrEP is going to be like long depot, yeah.
We're gonna start seeing a lot of gonorrheas and chlamydias and those things are they're not benign. They're not like They're not like Mickey Mouse diseases.
They're not.
People lose their lives. Like women come to us with PID and it can be like a hell show.
Yeah, that's like a pelvic inflammatory disease where there's a big infection in the pelvic area and it can cause peritonitis. It's like a generalized infection in the peritoneum. You can rupture your bowel. Like, guys, it's actually very serious.
You can end up with an ICU admission.
You can end up with organ failure.
Organ failure.
Yes, yeah.
It can lead to death.
And infertility.
People have died from that. And infertility is one of those big things that come after
a big infection like that. Yeah. You know what I'm saying? So it's not to be taken lightly, but when it comes to the act of the sexual intercourse, people are just weird and wonderful.
If you don't know somebody's sexual history, if you don't know their STI status, please use a condom.
And also, if you're going to not use a condom, please screen thoroughly. Yeah. Doing a rapid HIV test at home where you peel your finger, it's not the end all of screening.
Not at all. That's just HIV. Again, that's the only disease that people think about. But it would be best if like a couple, you get together, they start using condoms and they want to do away with condoms, do a whole full STI screen. It will benefit the both of you.
And including at least just HPV screening in the woman.
Yeah.
Not to say she's the only one who's bringing it, but if you find it there, then you can assume
that it was there
already. And also, if you do that after you've also engaged, you can say, we don't know who got it in its time, but let's keep it moving. Yeah. I'm going to make things a little bit personal right now. Fear not, because it's me. It's Ndim who's the person now. It's me. I'm a mom, as you know. So I've been pregnant. And I have a gift that keeps on giving from being pregnant.
Okay.
The lighter one is the fact that I have 2 shoe sizes now. My feet got big when I got pregnant. One went back, one didn't. Yes. Doctor of the pregnant women does not know this. So when I'm wearing closed, sexy court shoes, sandals are okay because you can play around with sizing, but in the straps. But shoes that are like shoes, a nice court shoe. One, I buy for the bigger foot, obviously, because pinching is not nice. And then I have to find a way to walk with the one that's slightly big so it doesn't keep slipping out.
And you can't ask for it all the time. Are you at work? Yes.
There we go, yeah. So if it's like a peep toe or like a sling bag and then it should be strategic with how I fit the insole, then when I walk it slips out or whatever, okay, fine. But that's like minor because even in my old age now with arthritis, Crocs and sneakers are the preferred mode of transportation when I walk. But I have hemorrhoids that I'm dealing with forever.
Hectic.
And it's the funniest conversation in my rooms when I see women, even gents who come in with a problem. I say, listen, talking from experience, this is how you manage hemorrhoids. You avoid things that trigger them. I know on long trips, long flights, whatever, I need to make sure I have my suppositories to keep them less swollen. And if I know I'm traveling for long, I also struggle with bowel motion adjusting. So then I have to take something to ensure that I don't become constipated to the point where I'm straining when I push. And I'm going to say I'm lucky if a week goes by that I'm going to have to push them back in.
They're
not sore.
But
They just, I just need to go pee. And they pop out. You know what I'm saying? That sucks, guys, you know? So, but like, I want to go to, do your patients, first of all, discuss this with you, number one. Number two, what are the biggest non-life-threatening complications post-birth that you've dealt with that you feel like, I wish I could take this away from my patients. I wish you guys didn't have to deal with this because now you just gave birth.
Hectic.
Or maybe you never thought about it because like you are just a privileged person who gets to work with the women but don't experience what they go through.
Because I got the Y chromosome. I'm thankful for my Y chromosome. I am very thankful for my Y chromosome. I say this with all the empathy in the world. I deal with women. I know what they need to go through. Just to have a similar test, an equivalent test to a male, there's more to do with a woman than with a man. Just to have a similar effect in terms of a procedure, for example, there's more to do with a woman than with a man. When you have to do with a man. There's more to consider. Fertility screening, just like I explained.
There's more to consider.
Sterilization.
It's much more invasive for a woman. Can the men have vasectomies, please? I'm throwing that in there. Vasectomies. Vasectomies saves relationships, save lives, because you can complicate more with a tubal ligation hysterectomy than with a vasectomy.
Now, I'm completely off topic because I'm off the question you asked. But since we're there,
I bring it. Giggle and be like, Mama, I'm sorry, but you know, it is just part of that life. You lost your teeth, but it's okay. You know, our friend Cindy lost her teeth.
Huh?
Cindy lost
she lost her teeth. She complained about that a lot. She always said like,
each pregnancy left with teeth.
She complained a lot about that. Look, okay, let's go back to the question.
Yeah, the complications that are not life-threatening.
We'll go back to the other stuff.
Yeah. Just so women can be aware that these
pregnancies. I was thinking the other day, it was actually earlier today or yesterday, I was like, but it was shortly because I've had a few complicated patients quite recently. Like, whenever I start talking about the things that can go wrong with pregnancy, you would think I want people to not fall pregnant because there's so much that can go wrong.
Absolutely.
And these minor things, which are not minor but quite inconvenient after pregnancy, can be such a pain and an inconvenience to a lot of women. From normal birth, one of the things that usually will come up if there was a tear and it was not properly managed, like the big tear that goes all the way to the anus, that can be a problem if it's not properly repaired because there's now incontinence. You know,
between the two spaces,
gas that just comes out, or sometimes stools just comes out with, and it's not nice for women who suffer from that. People have lost teeth, like you said.
Some don't have the same size feet anymore.
This is new to me. I've never heard of this. The other one would be C-section scars. It's still a mystery to me. I don't know what to say to patients when they ask me this. When it's cold, and it's going to happen a lot now, doctor, when it's cold, sorry, doctor, when it's cold, my scar
that is painful. It pulls, it tugs.
There's something there.
Yes.
I don't know why.
Like a wound contraction thing. It's a temperature thing, though. It is. I think for me, how I explain it because I don't have a C-section. I gave birth to my kids the raw dogging life way. You know, because I chose the lesser of the two evil for me. I'm scared of needles. So I chose to just push without epidural, without nothing. Literally, I was like, nobody's putting a needle in my back.
Should I high five you or not? I don't.
You high five me, dude, because yes.
Yeah.
So My analgesia was Atarax and pethidine for the first child. Second child, nothing, because his labor was very quick, thank goodness.
Sounds like what I needed to do last night.
Atarax and pethidine works, guys. Yeah. Anyway, calms the woman down. So, but from having other scars, I know that during the cold, they are more tighter. They're tighter and they're a little bit more sore to manage if the pain does come. Physiologically, I think it's because our body temperature is not supposed to drop that much. So when it drops, whatever happens internally for your body to control things, it's suboptimal.
I like that.
Yeah,
I like that.
It's the body temperature is not where it's supposed to be for your body to handle the things it can handle.
So things contract and they cause pain.
Yes,
basically.
Because when you're cold, and that's what happens when you go cold.
And the scar is not elastic.
It's not elastic because you cut and you stitch.
You cut, and then once that fibrous tissue forms.
Because you think when you're cold, you
literally.
So when the sky is cold,
that's what it does. Also, you literally stiffen your muscles.
Yes, so everything is stiff. The nerves get pulled, and you feel more aware of it.
Mystery solved. Now I can use that as an answer.
Mystery solved. Yeah,
it does make sense.
It does make sense. Yeah.
Look, if there are doctors watching and they've got a different.
If they have a paper, they want to throw it at us. Look at these kids. These charlatans. Where did you get your degree from? Proudly.
I don't know if
So yeah. So I think, but thanks for sharing that whole cesarean scar, and also the epidural the spinal from the Caesar. They also complain a lot about that.
There's also that pain from the spinal from the Caesar,
which raises head now and then, and it can even give headaches.
I'll tell you this. When I was a student, in my 4th year, there's this registrar, or he was a consultant at the time, I can't remember, but he told a story that happened to him where he delivered a patient normal delivery, and after that the patient couldn't walk. And they couldn't tell why.
Why? It's like some kind of neurogenic shock thing that just we don't know. Oh my gosh.
They say 1,000 ways to die?
Yeah, without an epidural.
There should be like 1,000 complications of pregnancy.
There is,
but people will not.
And you only know of what you know. Like for myself, I know what I know for myself, and I also know what I know from the textbook, because I've had the opportunity to learn, and also speaking to a lot of women. But also speaking to a lot of women has also showed me that even in med school, I only learned a handful of stuff.
And there's many other things that we
didn't know that you only see
or they're not emphasized, so they don't stick. They get mentioned once, and then if they don't intrigue your interest and they don't get repeated,
until you meet Lerato once. Hi, my name is Lerato. I live with hemorrhoids. I look pretty, but my bum pops out now and then.
But the hemorrhoids problem are quite common. Hemorrhoids problem in pregnancy and after pregnancy.
After pregnancy, yeah. But I think people expect things to just disappear forever. It's like, it's my battle scars of pregnancy, whatever people.
Have you tried bending them? Or you're like,
I don't want surgery. My brother is a colorectal surgeon.
So you are your own enemy here.
Yes. Okay, cool. I think my thing is that they're not causing me problems.
Just so you know,
I know how to manage them.
This is a doctor who has decided to not take medical intervention because she just doesn't want.
Because half of me is like a woo-woo, what hippie? I'm a woo-woo hippie. In another lifetime, running parallel to this one, I live on a farm and I walk barefoot all the time. We take shoes off in my house because I don't want germs from the outside. Like, I'm a woo-woo hippie. Yeah. But yeah,
but as doctors, we generally just like, this is not killing me.
This is not killing me. I know how to manage it until I'm in pain.
Yeah.
That's what we do. And then lastly, as a 40-year-old, 40 fibroids. Women want to know what causes fibroids.
We've spoken about these.
Specifically my fibroids.
Yours we've spoken about, but I'm not going to talk about here. I don't know.
40 fibroids, and there's a big buzz now. Perimenopause.
That's another new problem.
Does it present the perimenopause buzz? Is it presenting in your rooms?
It's a problem. It's the one thing about menopause for me, right, is I just said now, if it's not emphasized a lot, if it's not mentioned a lot, it doesn't become something you think about a lot.
But also, to be fair, perimenopause and perimenopausal stuff doesn't kill people.
Yeah.
So in medical school, you're learning mostly on how to save lives.
Yeah. So with menopause, we actually don't get that much
You're not going to
emphasis
depth
in medical school, right? It might be a part of a class, part of a tutorial. As a registrar, in a training as specialists,
in your testicles and because you big balls. No! The body takes care of it the same way that the body takes care of an egg that does not get fertilized every single month.
Yes.
Because the egg does not fall out the vagina. It doesn't. The body takes care of it.
The body takes care of it.
It literally absorbs it, and it's protein back into the body. Yeah. The shortest answer you can give, is there anything we can do to avoid getting fibroids?
No.
Okay. So it's one of those things that can happen.
One of those things that
there's a lot that contributes to it in terms of genetics, hormones, age, and all those things.
Lifestyle and all of those things. Yeah. But you can't really say, I'm going to avoid doing this and this and this.
And then I will not get fibroids.
Not get them.
Okay. Cool.
So everything involved in the development of fibroids is risk factor.
Yeah.
But it doesn't mean that you won't get, like you could literally have none of the risk factors and still get fibroids.
Yeah. Okay.
You could have all of the risk factors and not get fibroids. Okay. So it's just different from person to person.
I've loved talking to you, and I want to wrap it up now. What is a non-medical thing that you enjoy either engaging in or talking about that is not motorcycle related? That is not motorcycle related. We both enjoy travel. So I want you to venture into something that is like something that I wouldn't know about you because I haven't seen it on the socials or we haven't spoken about. I mean, we speak. So first of all, we met on Twitter.
Yes.
Right, guys. It's not when we were still called Twitter. That's how old our friendship is. Right. We met on Twitter, and it organically grew to get here.
Also, before Twitter was like.
Before Twitter became what it is now, yeah. Before it became X.
I'm not saying anything. Sorry, guys. For offending you.
Before it was still fun. It was fun banter. It was medical education. There was nice threads about fibroids and things like that. And you know what I'm saying? So I know a little bit of I know we have a lot of common interests.
Yeah.
When it comes to I don't ride motorcycles, but I like other bicycles, and we've spoken about motorcycles. And I love seeing my colleagues out of the stereotypical spaces, you know, because doctors are human too, and we have other interests. So, but apart from travel and motorcycles, what is it that something that I wouldn't know about you? Like I dance. People don't know that I actually dance in the studio. Like, but for me, it's a creative outlet for something that's very uncomfortable. Think pole, think burlesque, that kind of stuff. So, and I don't do that for social media, for show. It's a therapy for me.
Okay.
It's very therapeutic. People know I write, they know I speak, I do other things like that. But the things that they wouldn't see me as, oh my gosh, you do that? What is your, oh my gosh, you do that?
I don't know. You literally took the two things.
You don't have oh my gosh, okay, why do you like motorcycles?
I'm not that interesting, clearly. They free my soul. Motorbikes, a lot of guys that I ride with call it therapy. Okay. I don't like calling it therapy because it almost sounds like it takes away from the real therapy. However, it is therapy. It is therapeutic to get on a bike. It lightens the mood. It changes your perspective. You meditate when you're on a bike. Me on a bike is me having a conversation with myself. I love,
I get it.
There's fewer distractions. Your only thing is just traffic and idiots on the road. But other than that,
you have to be careful. Yeah.
I talk to myself a lot when I'm riding.
Meditation.
Long distance rides. I get to speak to myself.
You solve a lot of problems for yourself, right? Yeah. I do that when I run.
The only problem is I forget a lot of stuff that I think about.
But I don't think that you need to remember everything.
Yeah, no.
It's a process. You process stuff. And
when you're talking about processing stuff, that's fine.
Yes.
Now, I also get a lot of nice ideas to do something, to go somewhere, to send somebody a text, to
Yes.
think about something
When
funny
you get
and
home,
you want to share it with somebody.
Yes, when you get
When
home,
you
all
get
of
to your
that's gone.
destination, it's gone.
I know
All
that.
of
I
it.
get it. I do it on a
But
run.
it happens. So.
I do it on a run, and I've told myself maybe that I'm committing on camera. I must do it. I want to buy something that's like lights that can record, so I can just speak it.
So when I'm driving, I do that.
Yes,
now.
because I don't run with my phone. For two reasons. The main one is safety. I don't want to have like a visible anything that can attract people to come rob me. I live in Johannesburg. And the other thing is I want to take it in. I want to take the leaves in. I want to listen to my footsteps. I want to listen to my breathing. I want to hear the birds if they fly past me. It is downtime for me. Downtime is not just lying down in bed or by the pool or whatever. It is time to disconnect for me. So I don't want my phone near me for that. I do walk now and then with my phone. Typically like afternoon walks because I like the sunset. So when I get to a place where I can just catch a nice picture of the sunset, then but then I was like, oh, I wish I had my phone. So I always take that. Well, sometimes take that. So I totally get the fact that you get to where you're going, and also sometimes you get to where you were going, and not because you forget later, because when you got to where you're going, you got busy with what you were
Something
going
else,
to.
yeah,
Exactly,
completely,
you know what I'm saying? Yeah. Okay, so that's why you. But when did you get into motorcycles? How old were you?
Just only a few years ago.
So when you were a doctor, and you could afford them.
Into it. Yes, actually. One of the things that I wanted to get in internship was a motorbike.
Okay, so it was earlier on, even when you couldn't afford one.
Technically, I could. The problem was I was an idiot, like any typical male doctor that starts.
You bought a very expensive car.
Yes.
Okay, Internitis. You want to get the babes.
I love that, but it wasn't for the babes. I've always generally been in a stable relationship, except for a few times in my life. But just judging for
the testosterone,
I enjoyed that.
in an inanimate form.
I enjoyed that car. There's an element of not even. It was a C-class.
Looks decent.
Yeah, it was a
C-class. For an
like,
intern, that's like, major.
And I was like 26. It's kind of stupid.
Family car.
I don't have a C-class now.
Because you got more sense now.
The reason why I don't have a C, no. The reason I can't get a C-class is because I got it 10 years ago, over 10 years ago. And it propagated into my current struggles.
I got you.
Yeah. A lot of guys, especially who are doctors, probably have gone through that thing, and then they fix it. I struggle to fix mine because I'm terrible with finances.
Okay, that's another podcast to talk about doctors and speaking of doctors and money. If you won the lottery tomorrow, what would you do with your winnings besides canceling your debt? You know that, if you have any.
Okay. I think about this a lot because I do play the lotto.
Okay.
Wow. People get surprised when they see that the lotto was won by some doctor.
It's not me, guys.
And it's always it's you. I would probably invest most of it.
Okay.
And a small portion will be for traveling.
Traveling must happen.
I know I'm not going to shut down my practice.
Okay, that's interesting.
I'll just keep it to like manageable.
You'll keep numbers. It to good quality of life.
Yes. Thank you.
You will do it because you love it, because actually you studied further for like you went further to study, so you must love it.
Keep my life interesting. Sometimes
keep the service to the people.
Service to the people, and all of that.
And just pick and choose what you do, not do nighttime stuff. You've got somebody who works at night for you and all those things.
I could, because I could afford it, right?
Exactly.
A lot of patients wouldn't be happy about that, but get a pet partnership and be like,
yes, or like I do. Yes, I don't do after hour deliveries, or even I don't do deliveries unless I pick and choose. Yeah,
and they're all yours,
and I get
it's fine. Yeah, But for me, it wouldn't change much in terms of what I do on a daily basis, except I'll probably be having like every 3 months I'll have a 2-week holiday.
Yeah. There we go.
That's
nice balance. Last but not least, I actually think it's quite important because when I saw this card, I asked myself the same question, but here you are the guest, you must answer. Oh, by the way, these cards I bought for me and my kids.
Okay.
To just, have fun around the table.
Okay.
Some of them are quite funny, but I picked these for you. When you open your eyes in the morning, what is the first thing you think about?
Where am I? So we're listening.
Who am I?
Where am I?
Oh, where am I? Okay. He doesn't know who he is. Ladies and gentlemen, here
and I think it's a side effect of not always being home.
Okay. Because of traveling or because
of
work?
I go home,
You
work,
can sleep in
traditionally work.
Yes, the type of work that you do.
Many times, and I will admit this here because it's only natural. In many of my 24-hour calls, I have taken a nap. I can be expected to not sleep.
Because a robot away.
Even in a busy world,
you find a spot.
That 1 hour is important. I just make sure that nobody's dying. Find a spot. Take my hour nap. You tell the nurse,
listen, hold the fort. I'll be back.
If anything needs me, wake me up. Don't hesitate. I'm here, and I tell them exactly.
I just need to catch my breath so I can be the best doctor I can be.
Exactly. You need that, and I'd always tell my interns and students, for the guys. That's one. It's very important. Your brain function is still.
It's the difference between being a doctor who is doing what they need to be doing in a good way and making silly mistakes.
Yeah.
That can cost somebody a life and your career.
At 5 a.m., what round needs you to be thinking still very well. So, which day is it? And it's obviously more pronounced when I travel. And I'm always like, and one of the things, because I drink a lot of water and like coffee and
so you pee a lot.
So sometimes when I wake up, it's always like, which direction is the bathroom? So that's one of the things when I wake up at night. But I think to answer the question, in the morning, the first thing is, okay, where am I? What day is it? Do I need to go to work? Yeah.
Most of those days, Tshiamo, you need to go to work. Most of those days, you need to go to work.
Unfortunately. Well, unfortunately for me. Fortunately for the people I serve. I love my job. I hate leaving my house for it.
I actually get it.
I like when I'm at work, I'm happy.
I get it.
Up until a certain point, then I want to go.
Then you want to go.
Yeah. But when I'm home, I don't want to leave the house.
And you love your home.
When I have to leave the house for work, I get irritated. And then when I'm at work,
once you leave, like, why was I irritated? Actually, let's rock and roll. I get it. I don't have, maybe not to that level.
Yeah.
But I often joke, so to speak. I'll be like, people ask me, like, generally my first patient, when they say, well, hi, how are you doing? I'm fine, thanks. And how are you, doctor? And I'm happy now that I'm here. It's my safe space. Because at work, I run my own practice, as you do. And so, not because I'm the boss of everything, but that is where I know I'm definitely appreciated. I'm definitely more in control because now, as a mother of teens, I'm not in control of anything.
I've seen
there's a lot of curveballs. There's a lot of you don't know what's gonna happen. Like you're always just catching yourself. So at work, the things that patients bring to me, I either know exactly what to do, almost like always, or I know how to figure it out. I know how to stabilize if I can't, and then refer to a friend. So that's my happy place. Also because I love what I do, I love helping people, I love the craft of being a doctor. So yeah, so I get that whole leaving for work might be a little bit of a, I'm not going. My parents didn't have a trust fund for me. I could be going to work at 10 and not 8. But once I'm there, I'm the happiest. I'm the happiest person. Exactly. Yeah. My kids have that option. But thank you so much for coming out.
Thanks for having me.
I appreciate it a lot because this is third time lucky.
Oh yeah, because the past 2
weeks have been rough. You were supposed to come 2 weeks ago. Something happened. A life happened while you were being a good Samaritan. And then last week, these sniffles that you hear here and there, or the bit of a throat clearing, is because I guess I don't know where you got yours, but I often get mine from being at work. these viruses that attack the body?
This one was weird for me. I usually have stages of I know I'm getting sick.
Better, and then I'm getting better.
Here. It starts with my nose, and I'm like, can it just be like allergies, or can my body just find it off? Right?
But it didn't want to go.
And then it usually then it's throws. Then I'm like, it's over. Tomorrow I'll be coughing. This one, I woke up fine. In the evening, I was coughing like a dog, and I was like, what is happening? Did something go down the wrong tube? And now,
and it just worsened.
It just felt like maybe I aspirated something, and I just kept coughing. And
now you're here. But the reason why I said it was okay for you to come out today is because you had the worst symptoms last week. So generally 7 days later, and you are over the worst, and therefore are not or should be very little infectious and stuff like that. You know, it's just the remnants of your infection.
I was supposed to see my orthodontist this morning.
You cancelled
no, I asked her, and I'm like,
I'm gonna be in my mouth.
I've been coughing, and I thought I was getting better, but I'm still coughing now. Do you want me to still come? It's totally up to you.
The same question you asked me.
Yeah, and
like,
then
listen,
asks,
I was starting to feel better, but like now I'm here.
It's exactly.
And I'm just like, I'm bulletproof.
That was the exact same time. And she's like, are you infectious? And I'm like,
I was sickest last week.
No, I was like, if I come and you get sick, are you gonna sue me?
Take notes, we can sue Tshiamo.
She just laughed and she's like, please come next week. And I'm like, that's fine.
Okay. No, So I really do appreciate that. You know what? We third time lucky, and I enjoyed the insights you shared. I've learned stuff that I'm gonna share with my patients.
Thank you.
So thanks for the little bit of a lesson, you know, because I'm not a specialist. You know, I finished my school and I did a lot of things, and my extra learning is from what I'm willing to want to learn. It's not,
which is cool.
It's not what you're forced to learn because you must get a degree. You know, so I might miss a lot of stuff because it's not interesting to me.
But at the same time, you get to see a lot of other stuff that specialists don't see.
Absolutely,
We were just talking now about HPV screening. I will tell you about HPV screening in women. I won't tell you about men. I don't know anything.
Exactly. And I had to learn that about the men because I was counseling a couple, and the guy was like, but doctor, how do I make sure I don't give this to my wife? You know, responsible men.
Yeah.
It's like, if it's me, what if it's me? What do I do? Because I don't want her to get cervical cancer. And I'm like, you know what, my guy, it's okay. This is what the data is. We just keep monitoring. You know what I'm saying? So now at least you took something away. You can counsel your patients there. And people can find you at Zamokuhle or Raslouw Medical Center.
Yes, both practices. So I'm available Tuesday to Friday for consults. It's just different days.
You do theater,
But
I mean, you know, so I will just include your telephone numbers in the text.
Oh yes,
I shall do that. Okay, you know, and I wish you a safe trip home.
Thank you.
Thank you so much. I want to hug you as I normally do hug my guests, but I sat close to you. It's okay. That's enough. That's enough close distancing to you. But I really appreciate you for coming out, you know, on a cold winter night while you're feeling sick.
Thank you for having me.
Thank you for tuning in again. It's Dr._Lovelee on Instagram and X and Facebook, and Dr. Lovelee on live on YouTube and TikTok. Watch, share, enjoy, and stay lovely.